Laryngeal cancer. The very name can send shivers down your spine, but knowledge is power. In this video, we'll break down everything you need to know about this disease, from its causes and symptoms to diagnosis, treatment, and prevention. We're here to empower you with information and understanding. So, what exactly causes laryngeal cancer? The primary culprit is tobacco use, including smoking cigarettes, cigars, and pipes. The longer you smoke and the more you smoke, the greater your risk. Excessive alcohol consumption, especially when combined with smoking, also significantly increases your chances of developing this cancer. Other risk factors include exposure to asbestos, certain human papillomavirus (HPV) infections, poor nutrition, and a family history of head and neck cancers. To understand how laryngeal cancer develops, we need to look at the cells lining the larynx or voice box. Normally, these cells grow and divide in a controlled manner. However, when exposed to carcinogens like those found in tobacco smoke, these cells can undergo genetic mutations. These mutations can lead to uncontrolled growth and division, forming a tumor. Over time, this tumor can invade surrounding tissues and organs, and even spread to distant parts of the body through a process called metastasis. Laryngeal cancer, while not the most common cancer, is a serious concern. The incidence varies globally, with higher rates generally observed in regions with greater tobacco and alcohol consumption. It's more prevalent in men than women, and typically diagnosed in individuals over the age of 55. Understanding the epidemiological factors helps identify populations at higher risk and implement targeted prevention strategies. The signs and symptoms of laryngeal cancer can vary depending on the location and size of the tumor. Common symptoms include persistent hoarseness or voice changes, a sore throat that doesn't go away, difficulty swallowing is dysphagia, a lump in the neck, ear pain, persistent cough, and unexplained weight loss. If you experience any of these symptoms for more than a few weeks, it's crucial to see a doctor for evaluation. Diagnosing laryngeal cancer typically involves a thorough physical examination, including a laryngoscopy, a procedure where a thin, flexible tube with a camera is inserted into the larynx to visualize the vocal cords and surrounding tissues. A biopsy, where a small tissue sample is taken for microscopic examination, is essential to confirm the diagnosis. Imaging tests like CT scans, MRI scans, and PT scans help determine the extent of the cancer and whether it has spread to other areas. Laryngeal cancer is classified based on the location of the tumor within the larynx and the extent of its spread. The most common type is squamous cell carcinoma, which arises from the flat cells lining the larynx. The stage of the cancer, ranging from stage 0 to stage IV, indicates the size and location of the tumor and whether it has spread to lymph nodes or distant organs. This staging is critical for determining the appropriate treatment plan. Treatment for laryngeal cancer depends on the stage and location of the tumor, as well as the patient's overall health. Treatment options include surgery, radiation therapy, chemotherapy, and targeted therapy. Surgery may involve removing part or all of the larynx, depending on the extent of the cancer. Radiation therapy uses high-energy rays to kill cancer cells. Chemotherapy uses drugs to kill cancer cells throughout the body. Targeted therapy uses drugs that target specific molecules involved in cancer growth. In some cases, a combination of these treatments is used. Supportive care, such as speech therapy and nutritional counseling, is also an important part of the management process. Preventing laryngeal cancer is primarily focused on reducing exposure to known risk factors. Quitting smoking and limiting alcohol consumption are the most important steps you can take. Avoiding exposure to asbestos and maintaining a healthy diet rich in fruits and vegetables can also help reduce your risk. HPV vaccination can also protect against some HPV-related head and neck cancers. The prognosis for laryngeal cancer varies depending on the stage at diagnosis and the treatment received. Early-stage laryngeal cancer has a high cure rate. However, advanced-stage cancer is more difficult to treat and has a lower survival rate. Ongoing research is focused on developing new and more effective treatments for laryngeal cancer, including immunotherapy and more precise surgical techniques. These advances offer hope for improved outcomes in the future.